Thank you very much.
Tia Boatman-Patterson, and I'm the Executive Director with the California Housing Finance Agency. And I thank you for your leadership in advancing the Veterans Housing and Homeless Prevention Act of 2014 to provide funding to advance comprehensive, coordinated, and cost-effective approach to respond to the needs of our veterans. Collaboration is messy. And I think at the end of the day, what we have are stronger policies, stronger integration, and we still have much work to do, but collaboration is messy. And I think the three of us here brought our three different organizations with three different cultures to the table, and we pounded it out, and I think it was very successful at the end of the day, what you saw be accomplished. Veterans brought their cultural competencies and what it means to serve vets. Housing brought policy and development, the ability to get out funding to develop housing, and CalHFA brought their experience in financing affordable housing. So I want to start higher up and then go kind of down to where we are today, just to remind people where we are and what we have done at a national, state, and local efforts to end not just veterans housing, but homelessness. So beginning in 2000, the National Alliance to End Homeless announced a very bold initiative and blueprint plan to end chronic homelessness in 10 years. That was in 2000. Since the release of that blueprint, the federal government, the state of California, and many local jurisdictions endorsed the idea of planning to end chronic homelessness in 10 years. In 2005, the Schwarzenegger administration launched the Chronic Homelessness Initiative, which included a creation of an interagency council comprised of leaders of 11 agencies and departments with the responsibility for housing and services for citizens at risk of all and those that were already chronically homeless. The Interagency Council initiated the process of collaboratively developing a 10-year plan to end chronic homelessness and a vision statement. That was followed in 2006 with the California voters approved Proposition 1C, a legislatively referred bond act known as the Housing and Emergency Trust Fund Act, which aimed to provide housing for needy families, seniors, and military veterans. In 2010, the White House announced the Department of Veterans Affairs announced a 2010 plan to end homelessness for veterans by the end of 2015. With partners nationwide, I think Ms. Gunn spoke to this as well, the VA launched their End the Veterans Homelessness Initiative to make sure veterans were able to provide permanent housing, and veterans at risk of homelessness stayed housed. And so we in California have been at the forefront of these issues, and as Ms. Gunn said, we were the first in the nation to step up and answer that call with $600 million commitment from the state of California to provide housing for our most vulnerable veterans. That is a very broad definition that you included in that legislation, and you included that very broad definition so that we can make sure no one was falling through the cracks. So since 2006, CalHFA has administered $400 million of original allocation of Mental Health Service Act funds. The original goal of that program was to create about 2,000 units of housing for those that were had mental health issues, that were homeless or at risk at homelessness, with the ability to create an additional 10,000 units of affordable housing, permanent supportive housing, to help with homelessness. CalHFA, that funding is almost completely gone. That program was initiated via an MOU, another state partnership between CalHFA and the Department of Health Services at the time. That agreement expires at the end of May of 2016, and so we are continuing to have those conversations. But as a result of having some experience in providing housing for mental health and dealing with that very vulnerable population, we did not ask at the time whether we were serving veterans. So the data that has been collected is very suspect. And that hasn't been something that we have traditionally done as housers, is to collect the appropriate data and build those performance goals and measures on the front end so that we know that the program is succeeding on the back end. And so I think AB 388 is very helpful to us to be able to then start getting some performance goals and measures and actually knowing the populations that we're serving with our housing programs. So if you were to ask what are some of the barriers that continue to exist, I would say system and funding fragmentation. And when I say system and funding fragmentation, it's because I think we need to focus a little more on understanding veterans, which are some of the things that Ms. Gunn brought up in her testimony, and Medi-Cal systems. Not all veterans or folks that we have defined veterans in this particular program are veterans that have had combat, that have left the United States. And so they oftentimes will not identify them as veterans. So we may need to change the way we're asking the questions and gathering that data. Had you ever served in the military? So that we can make sure that we have no one that's falling through the cracks. Perhaps there are veterans or folks that have formerly served in the military that aren't eligible for certain veterans benefits, but they're eligible for Medi-Cal benefits. How do we start integrating those systems and learning from traditional chronic homeless service providers and veteran service providers and cross-training one another so that we can build cultural competencies and competencies in other areas? Local governments all have to submit what is called an HMIS system, and it's the integrated system, the coordinated system for your COC dollars, your continuum of care dollars. And it is very fragmented in how that data is collected and then reported up to the federal government. Are we including in that continuum of care and that coordinated entry? Are we coordinating those efforts with the veteran service providers? I have heard from several stakeholders on the housing side that coordinated entry system that we use to deal with our continuum of care often does not include veteran service providers or our veteran services officers. So then to be able to take those county veteran service officers and coordinate and make sure that they're at the seat of the table at our coordinated entry system to make sure that if there's services here that can be provided, that those are listed. If there's services here that can be provided on the other end, that those can be provided. And I think that system funding and fragmentation needs to be addressed. The need for coordinating services better to include Medi-Cal. If I were to say two of the committees that I would like to see represented as we talk about veterans homelessness and getting our arm around this, I would like to see the Health Committee at the table. I think it would be very important to have local government at the table, because without local government and those partnerships and the continuum of care dollars, we won't be able to do this without effective partnerships. I'd like to see public safety at the table. I think to be able to get at this holistically, you have to address this from multiple sides. Continued leadership and systems coordination would be my second issue. The need to strengthen partnerships within the state, our external partners, and continue to focus on outcomes that necessitate a shift in looking at outcomes of veterans and not just units produced. We usually produce units, and we come back to you and we tell you how many units we've produced. What we really need to start thinking about are the lives of the people that we touch and those outcomes and those lives that the people we touch. And that's where I believe the Department of Veterans coming to the table helps us to have a more comprehensive view about those systems and that coordination. And my last thing I would say is we have inadequate data and information. The need for a database system and an infrastructure to support and collect the necessary information to interface with other housing and state data systems, and recognize the need to see more rounds and understanding the effectiveness of these policies. So if I were to tell you what my recommendations would be, it would be data collection, a need for a better database system to capture veteran demographics and an ongoing housing status and health outcomes. And I would consider building off or creating a statewide standardization of the HMIS. We have put no state investment into the HMIS, and we have 58 different counties who are all doing it probably 58 different ways. A system to coordinate the funding for the continuum of care and building off of that system. It is important that we intentionally collect data for all state housing programs on military experience, and including those that have served in the military, and including those that may have been dishonorably discharged. Collecting data is an important piece of determining who programs are serving and how we are serving them. Without the data, we really cannot answer the questions of how many veterans are being assisted with other state supportive housing or multifamily housing programs. I would recommend that we take a pause on any new legislation until we have better data on programs, awards, and outcomes. The legislation you delivered to us was broad to give us flexibility to adjust through guidelines. A small state investment in standardizing HMIS and assisting with infrastructure and a coordinated entry system would assist in integrating opportunities and outcomes. And lastly, I believe we should continue to coordinate veteran programs with other county, state resources. CalVet with other homeless service providers for chronically homeless should be incentivized to learn from each other and to build on each other's capacity so that we can continue to serve this most vulnerable population. Cross-training on veteran service programs and other state and local housing programs, including the Mental Health Service Housing Act programs, to ensure veterans are receiving all the benefits of which they are entitled. Stakeholders, I mentioned this earlier, several stakeholders have said that the VSO or the Veteran Service officers are often excluded from the coordinated entry systems and existing community resources and the creation of the homeless coordinated assessment systems. These coordinated entry systems are increasingly becoming an entry point for homeless veterans and programs offering housing, yet we don't have the veteran service providers sometimes at the table in those coordinated entry systems. And lastly, I think both of my counterparts have talked about the funding for services. The lack of services funding continues to be a barrier to serving this highly vulnerable homeless veterans and units created through housing. I would also throw not just funding for services, though, it's that very critical rental subsidy or operating subsidy. What you have given us is $600 million to build affordable housing. That's the capital to build the affordable housing. In order for that affordable housing to be successful, it needs to have rental subsidies or operating subsidies so that it can continue to operate after it's built, and it needs to have these wraparound services so that we can make sure that we're affecting the outcomes of the lives of the individuals that we are wanting to help. And so that concludes my testimony, and I'm available if you have any questions.
Thank you very much for your presentation. Now let's open it up for Q&As. Are there any questions? Ms. Brown, go ahead.
Thank you. First of all, it's a wonderful panel, and it's really great to come and to hear what happens to what we put forth, a couple years ago. So it's great to be here. Wanted to ask you, Tia, Ms. Boatman, you said that there were 1,200 units built, and only 566 went to vets. Was that you or was that you? I'm sorry.
Yeah, so 1,221 affordable housing units total, of which 566 units were VHHP assisted. So in some cases, we would have an affordable housing development that wouldn't be 100% for vets, or may have some mix of supportive housing, different income levels, and so it could be a mix, but not necessarily 100% VHHP supported.
And let me clarify that. And so the VHHP money in those developments only went to those units that were VHHP. But because that money went into a larger project, she got more affordable housing units, but only the VHHP money helped support those VHHP units.
I don't know if that answers the question, because you said you built 1,200 units, but only 566 of them went to vets.
She funded 566 units. And by putting that funding in to fund 566 units, they were able to get 1,200 units. So that 566 is what her funding went to fund.
So generally, in an affordable housing development, there's a funding gap that exists, and it'll be that funding gap is typically filled by a number of different funding sources. And so, I mentioned that the vast majority of the projects had low-income housing tax credits in there, and so low-income housing tax credits aren't limited to veterans. It can house a range of different populations, and so there might be low-income housing tax credits. It could be multifamily housing program as well as VHHP, and so those funding sources were layered together in order to create a larger number of affordable housing units, of which 566 were supported by and restricted to house veterans under this program. Does that help?
That helps me a little bit.
Okay.
Couple other things. One, you talked about the system fragmentation of the system. And I'm finding the same thing with aging and long-term care. is there a solution? Because it sounds like it's not just one part of our state. It sounds like there's more.
I think this is a system-wide issue. It's because you're dealing with a population that may have many issues. And just by providing the housing by itself is not going to be enough. You have to have that housing with the supportive services. And sometimes those supportive services may come from a variety of different places. You may get the supportive services from a case management because it's a VASH voucher. You may get the supportive services because it's SVP, which is another veteran federal funding source. Or you could be getting the services from Medi-Cal. And those are agencies that sometimes don't even talk the same language. And so you have systems that are tailored to help a certain population, but you have populations that cross over those systems. And so you get this fragmentation and not this coordinated approach. And so to be able to have that coordinated approach, I told you collaboration is messy. It is very, very difficult, but until you put the time in, effort and resources that are necessary to have that collaboration, then you'll continue to have those kind of fragmentations. You need to be able to incentivize one another to talk with one another and be able to bring those pieces together.
Okay, two other things.
And I'll just add to Tia's comments. A lot of this really reflects the funding silos that we've really established: federal, state, local. Local both at the county level, the city level, as well as among public policy areas. Oftentimes we'll line those up, but it really is not. It's a conscious after the fact, but not necessarily upfront trying to align our guidelines, align the programmatic pieces. Along government and public policy silos. So it really is a reflection of that. And so when we enter into these collaborations, the reason it's messy is we're not accustomed to speaking each other's language. We don't use the same lens. And so I think that's part of this process. And the beauty of this program is that we really are pushing ourselves to align, to think along the same lines, to try and speak the same language, to decode some of the things. I mean, I think anyone who is around affordable housing very long understands that we have lots of acronyms, and we have our own language, and I think that would go for certainly the services area as well. And so I think it really is a reflection of the way that we've funded different aspects of public policy.
Okay, Mr. Chair, I just have two more things. One, you talked about data collection, and it seems that that's an issue everywhere I go in the state. What's your solution?
I would put some resources into HMIS. I would look at standardizing that, and I would talk about coordinated entries and how we could work to have coordinated entry systems align with not just the county continuum of care folks, but with the veteran service providers. And so I would really put some resources into the HMIS data system.
Thank you. And lastly, I know you've done extensive outreach in the state, and I was looking at the Inland Empire, and I noticed that you included Orange County. Is that, whenever you do that, is that like a standard thing that you include the Inland Empire and Orange County together? Is there some reason?
It is not. It's not necessarily typical, but from the perspective of where we were seeing similar demographics and concentrations, it made sense in the context of this particular program. But it is not necessarily what we do across programs.
Yeah, I was going to say Inland Empire is kind of by itself, and whenever we add other areas in, it really dilutes, and we have probably more veterans in our area because of Norton Air Force Base and because of March Air Force Base, because of the High Desert Air Force bases. We have more veterans in our area. So I would like to see us do some more concentration on the Inland Empire. And I noticed you're having a workshop in Riverside. I would also like to say that at some point I'd like to see you do something in San Bernardino, because the need, especially when it comes to homeless veterans, would be in that particular area. Thank you.
Thank you for your questions, Ms. Irwin.
Yeah, this has been very informative, and I think it's really important to do these oversight hearings early to make sure that this money is spent appropriately and effectively. And I really like what Ms. Patterson said about data collection. And I would like to know specifically what we have to do to make sure that happens, because there is no way that you can judge how effective this program is if you don't have accurate data. So I just had a couple of questions. The first is, I think everybody really mentioned the funding for services, but you tell us what are possibilities of, where will that funding possibly come from?
So we're working really, really closely with our federal partners right now, and accessing as many resources as possible to align with the program. I mean, they understand, the fact that we really stepped up as a state to try and address the problem of veteran homelessness, and so they're very willing participants and are engaging in really productive conversations about how we can bring more VASH vouchers to the state, SSVF funding, those types of resources in order to support the program, because they understand that the gap exists.
Yeah, well, and especially for the homeless part of the population, housing alone is just absolutely not going to do it. So we do need to keep focusing on that. The other thing you talked about, Ms. Riggs, was looking at how you're doing, and as these units are being built, are this appropriate services, appropriate areas that you're building in. But what is the timeline for opening the doors on these some of these projects? The money was just issued, and it seems if it's a few years down the road, the next round of money is going to be issued, and the following round of money is going to be issued before anybody's really opened their doors. So how will you, along the way, judge how effective a job you're doing?
It's absolutely right. I mean, these are projects that, will be breaking ground in, the next few months to the next year, maybe even longer. I think one of the things that we do want to emphasize in the second round and subsequent rounds is readiness. I mean, ensuring that, that the projects are as close to as possible as to breaking ground and being put into service as possible. But in terms of, tracking the success, I mean, obviously, we won't know the success until they've, been placed into service, and we can begin to collect the data that we've spoke about today.
And so what is the timeline for the first projects opening?
I don't think we have a specific timeline on any of them yet.
Yeah, we do.
We do?
I remember the dates. I'm sorry, we can probably get you the dates. As I remember, the first one coming in or coming online will be the end of 2016. That one was really ahead of many of the other ones. But the majority of these first projects won't be coming online until mid to late 2017, if I remember right.
Right. I think you should hold us accountable on some of our permanent supportive housing units that we've already created, and ask us and give us the resources to look at that. I'll give you an example on just my MHSA, which is our Mental Health Service Act funds. So I started asking the question in January, well, how many vets are we serving in our MHSA? And my staff literally came back and said, well, we've never asked that question. Well, why have we never asked that question? We weren't required to ask that question, so we didn't ask that question. And so I own that. And so as new MHSA applications started coming in, I required that my staff specifically ask in the application of these units, how many formal veterans or folks that had served in the military do you plan to serve? In your development, how many of your permanent supportive housing units are serving veterans? And so they gave me back some statistics, and I think some of them are quite pitiful, but I will share them with you. So of the 6,000 permanent supportive housing units created, 119 developments, of which there was MHSA money in those units. So we have probably 2,000 units of the 6,000 that were specifically set aside for Mental Health Service Act folks. And 172 of those 6,000 units we know are serving vets. That's because we went and we asked them, and they kind of self-certified. Now, mind you that this data could be skewed because you may not identify as a vet if you've never served in combat, or you've never gone out of the United States, or you've fleshed out after basic training and some of these other cultural competencies that I'm learning about. So whether or not, though we have more in our MHSA units or our larger permanent supportive housing developments, I don't have the data to be able to provide those evaluations. And so I think holding us accountable to go back and looking at some of our MHP multifamily housing programs, looking at our permanent supportive housing units that we've created in the state of California, who are we serving, how are we serving, how many chronic homelessness folks have we gotten off the streets, but to be able to collect that data and do that evaluation and provide it back to you requires resources. And I believe HCD may have asked a couple of times for some of those resources and were turned down. We're not talking about a whole lot of money, but we're talking about providing you with the data that you need so that you can make informed decisions. We're talking about a little bit of money to create an infrastructure so we could have a standardized process for HMIS. But in order to do that, now these units are going to take a little while, but we do have data on permanent supportive housing and chronic homelessness, of which veterans are a category of the folks that we were supposed to be helping. So I just add that.
All right. Well, that's very helpful. And again, I think it is a significant investment that's being made, and we need to, as a legislature, make sure that the money is being spent the way it was intended to be spent, and efficiently, and get these units up as quickly as possible. So certainly, my intention to hold everybody accountable, and I guess we'll have to look at where that funding comes from to get the data we need. But I appreciate your candidness and testimony of all three of you. Thank you.
Thank you very much. I do have a couple of follow-up questions, if I may. First of all, can we kind of elaborate on some of the unsuccessful applicants, and basically some of the reasons why they were turned down? And was it because of their supportive service plans were not up to par? What were the major reasons for them being turned down? First of all.
So there were really a variety of reasons. I mentioned, really because of the time frame in which, applicants had to prepare and submit applications, and the novelty of the program, the partnerships weren't necessarily in place. The program, projects weren't necessarily designed for these populations and didn't really meet the criteria that we had put out in the guidelines. And obviously, the development sponsors are, planning for their projects, 18 months, 24 months, 36 months even in advance. And so when a funding source comes in kind of late in the pipeline, it's really difficult to kind of backtrack and, change the design, change the features, change the, types of units, the unit mix, those types of things. And then, really, as I spoke to earlier, the silos that we've kind of lived in, between, service providers and, housing development sponsors, has really, with MHSA, with MHP, supportive housing, those types of things, has been growing. But really, this particular program brings it to a whole new level. Mm-hmm. And so, really, giving developers and service providers the time to strengthen those partnerships, to, align, the service provision and the development, takes a little bit more time. So I think that's probably a primary factor, is really just the time frames. But beyond that, the applications that actually went through scoring and, were competitive, but, did lose points were, in a variety of categories, not really any particular, there wasn't any particular cause we could point to, but, as I mentioned earlier, the places where folks tended to lose, a significant amount of points that seemed to contribute to being less competitive was, the quality of the supportive services plan. And, one of the kind of lessons learned for us was really clarifying exactly what we were looking for there. And so we're, providing some more clarity in the second round to make sure that folks know exactly what it is that we're looking for. Project readiness. And, this was, something because we did want to kind of create some time frames so that we could bring units online quickly. And so folks may not have been far enough along, may not have secured all the resources necessary to bring to break ground and to move forward with constructing the project, and then the experience of the lead service provider. So those were the areas where we saw,
what about rental subsidies?
Yeah, and
I thought that was like a really big one.
Yeah.
The folks that weren't able to bring in that rental operating subsidy piece, right?
And were they also the same reasons for us allocating only 63 million out of the 75 million available.
Yeah, a very similar, set of circumstances. Really, readiness. The level of relationships. The how far along the projects were in terms of, moving down the pipeline in terms of their design and the features of the development, and really just not being ready with, the level of service plan that we were looking for in order to meet the needs of the populations that we're trying to house.